Hi, my name is Dr. Pradeep. Good to see you all. Today I am going to talk about Pectus deformities. What are Pectus deformities? What are their symptoms? How they present? And how we can diagnose the Pectus deformities and how we can treat these patients. So pectus means chest wall. So basically pectus deformities are the chest wall deformities. Specifically anterior chest wall is involved in these patients. So most of the time these are the congenital deformities. They can be an isolated problem or can be a part of a syndromic problem, just like Marfan syndrome. Though these are very rare deformities, but one in every 1500 children are born with pectus deformities. Pectus deformities are two kinds of deformities: pectus excavatum and pectus carinatum. Pectus excavatum means there is a depression in the anterior chest wall. So these are the pectus excavatum deformities. Pectus carinatum is also called a pigeon chest deformities, where the anterior chest wall is a little bit elevated from the rest of the chest wall. So these are called pigeon chest deformities or pectus excavatum. Basically, pectus excavatum and pectus carinatum, these deformities usually are because of the growth differences between the costal cartilage and the sternum. So sometimes what happens, the costal cartilage, they overgrow the sternum, and there is a depression in the sternal area. So these are called and they present as a pectus excavatum. Sometimes the costal cartilage, they push the sternum forward and cause the pectus carinatum. So basically there is an imbalance of growth between the costal cartilage and the sternum. So that's how they present as a pectus deformities. Now, how can we diagnose these kind of deformities? So once you go to a doctor, he can examine you clinically, and he can tell you what kind of deformity you are having, whether it's a pectus excavatum or pectus carinatum. Most of the time it's just a cosmetic deformity. There is no functional issues, but sometimes the patient may have some symptoms like respiratory symptoms. He may have some difficulties in breathing, difficulties in walking. Sometimes they also have the cardiac issues like heaviness of chest wall, palpitation. So they also present with these deformities. But most of the time it is just a cosmetic concern because of the depression or the elevation of the chest wall. The doctor examine you, he will write you some investigation, some radiological investigation to know the status of the chest wall, the kind of deformity you're having, the status of the sternum and the rib cage. So they will advise you some CT scans to know the lungs and the condition of the heart. And you may also need to visit the cardiologist and pulmonologist to see whether the respiratory and the cardiac fitness is there. So that's how we diagnose the patients with pectus different deformities. When we talk about the treatment of these patients, when these patients present early in the childhood, so in those cases, the help of the conservative management like braces, or with the help of the splint, we can mold the chest wall as per the convenience. Because in children, the rib cage is still developing. So with the help of the splint, we can manage the shape and the size of the chest wall as per the normal structure. But when the growth of the rib cage already happened, say after 12 to 14 years, so in those cases only the treatment of size is purely surgical. We do the corrective surgeries to make the chest wall look normal. So the surgery is little bit complicated, though the time of the surgery usually 3 to 4 hours. And after surgery, usually we keep the patient in ICU for a day for the observation, for the analgesia. And after that, we shift the patient to the general ward. And the total number of stays usually 3 to 4 days. And after that, the patient is gradually and slowly rehabilitated to the normal life. And there is a lot of physiotherapy, breathing exercises involved, a little bit gentle chest physiotherapy is involved. So with the skilled hand, we can assure you that you can get a good result with good functional and the aesthetic outcome. So if you are looking for a pectus surgeon what should you do, what should you look for. So if you are looking for a plastic surgeon who can do these kind of surgery, so the plastic surgeon should be skilled enough. They should have all the paraphernalia, like they should have all the support, like ICU support, critical care support, cardiac support, and respiratory support before you can go and get the surgery done. And there's a lot of counseling, parents counseling, child's counseling involved before the surgery and the post surgery. So yes, with the skilled hand you can get the best result out of these deformities. Stay tuned for more videos, subscribe our channel, call us on this number and connect us on WhatsApp, and you can visit our website for more information.